Joint pain affects millions of people worldwide, limiting mobility and reducing quality of life. While many rely on medication for relief, there are natural, scientifically supported methods to reduce pain and improve joint health for the long term. Unlike teeth, which do not regenerate, joints have the ability to repair and rebuild cartilage under the right conditions. However, factors such as aging, inflammation, injuries, and poor lifestyle choices can accelerate joint degeneration. In this video, we will explore effective, research-backed strategies to restore joint health without medication. Key topics include the best foods to support cartilage regeneration, the role of exercise in maintaining joint flexibility, the impact of weight management on joint pressure, effective home remedies for pain relief, the science behind inflammation and how to control it, the differences between osteoarthritis and rheumatoid arthritis. Additionally, an orthopedic specialist with over 30 years of experience will provide insights into how muscle health directly affects joint function and how targeted interventions can significantly reduce pain. Why do joints become stiff and painful? Joints are protected by cartilage and synovial fluid, which cushion movement and prevent friction between bones. However, as we age, several changes occur that contribute to stiffness and pain. Cartilage degradation. Over time, cartilage naturally wears down, reducing its ability to absorb shock. Reduced synovial fluid production. This fluid lubricates the joints, and its decline leads to increased friction and stiffness. Inflammation. Chronic inflammation can trigger pain by irritating nerve endings in the bones and surrounding tissues. Muscle imbalances. Weak or overly tight muscles can put excessive stress on joints, leading to discomfort and decreased mobility. According to the Centers for Disease Control and Prevention (CDC), osteoarthritis affects over 32 million adults in the United States alone, making it the most common cause of joint pain. Meanwhile, inflammatory conditions such as rheumatoid arthritis, gout, and autoimmune disorders also contribute to joint degeneration. Understanding different types of joint pain. Not all joint pain is the same. Identifying the cause can help determine the most effective treatment. 1. Pain during movement, often associated with osteoarthritis, which results from cartilage wear and worsens with activity. 2. Pain at rest, common in inflammatory conditions such as rheumatoid arthritis, where the immune system attacks the joint lining. 3. Morning stiffness. If stiffness lasts for more than 30 minutes, it may indicate an inflammatory condition like rheumatoid arthritis. 4. Sharp, sudden pain can be a sign of gout and accumulation of uric acid crystals in the joints. Early intervention is key. Understanding whether the pain stems from wear and tear, inflammation, or metabolic factors helps in selecting the right approach for relief. Short-term relief versus long-term solutions. While over-the-counter pain relievers like ibuprofen and acetaminophen provide temporary relief, they do not address the underlying causes of joint pain. Long-term solutions involve reducing inflammation, maintaining a healthy weight, strengthening muscles, and optimizing nutrition. The role of movement in joint health. Contrary to popular belief, avoiding movement worsens joint health. Regular physical activity has been shown to stimulate synovial fluid production, keeping joints lubricated, strengthen muscles that support and stabilize joints, improve circulation, which delivers essential nutrients to joint tissues. Best low-impact exercises for joint health. Swimming provides resistance without putting stress on the joints. Cycling improves mobility and strengthens leg muscles. Yoga and Tai Chi enhance flexibility, balance, and range of motion. According to the American College of Rheumatology, regular exercise reduces joint pain and stiffness in people with osteoarthritis by up to 30%. The best diet for joint health. Nutrition plays a vital role in maintaining joint integrity, reducing inflammation, and supporting cartilage regeneration. A well-balanced diet rich in anti-inflammatory foods can help alleviate pain, slow down joint degeneration, and improve overall mobility. Key nutrients for joint health. 1. Omega-3 fatty acids, found in fatty fish such as salmon, mackerel, sardines, and tuna, help reduce inflammation by decreasing the production of inflammatory cytokines and enzymes linked to joint pain. A study published in the American Journal of Clinical Nutrition found that people who consumed high amounts of omega-3s had lower levels of joint stiffness and pain. Number 2. Antioxidants, vitamin C and E polyphenols, found in citrus fruits, oranges, grapefruits, berries, blueberries, raspberries, strawberries, and dark leafy greens. Help neutralize free radicals that damage joint tissues. Polyphenols found in green tea and dark chocolate have been shown to reduce oxidative stress in joints. 3. Collagen and gelatin, found in bone broth, chicken skin, fish skin, jellied meat, and collagen supplements. Collagen is a major component of cartilage and helps maintain joint flexibility and strength. A study in the Journal of the International Society of Sports Nutrition reported that collagen supplementation improved joint pain in athletes. 4. Vitamin D and calcium, found in dairy products, fortified plant-based milks, eggs, and fatty fish. Essential for maintaining strong bones and reducing the risk of osteoporosis-related fractures. A deficiency in vitamin D has been linked to increased joint pain and inflammation. 5. Vitamin K and magnesium, found in spinach, kale, broccoli, almonds, and seeds, support bone mineralization and help reduce inflammation. A British Journal of Nutrition study found that magnesium intake is associated with a lower risk of knee osteoarthritis. 6. Protein, found in lean meats, poultry, fish, tofu, lentils, and beans, essential for muscle maintenance and repair, which supports joint stability. 7. Curcumin, turmeric, found in turmeric, a spice commonly used in Indian cuisine. Curcumin has strong anti-inflammatory properties and has been shown to be as effective as some NSAIDs for joint pain. A meta-analysis in the Journal of Medicinal Food concluded that curcumin supplementation significantly reduced symptoms of osteoarthritis. Foods to avoid for joint pain. Some foods contribute to inflammation and worsen joint pain. Reducing or eliminating these foods can help manage symptoms. 1. Refined sugars and processed carbohydrates, found in candies, baked goods, sodas, and sugary cereals, cause spikes in blood sugar levels leading to increased inflammatory markers. 2. Fried and processed foods, high in trans fats which promote systemic inflammation, include fast food, chips, frozen meals, and packaged snacks. 3. Excessive red meat and dairy can increase levels of uric acid, which may worsen gout and inflammatory joint conditions. Processed meats like bacon and sausages contain preservatives that trigger inflammation. 4. Alcohol and sugary beverages. Excessive alcohol consumption can lead to dehydration and nutrient depletion, worsening joint pain. Sodas and sugary drinks contribute to obesity, increasing stress on weight-bearing joints. By incorporating more anti-inflammatory foods and avoiding inflammatory triggers, individuals can significantly improve their joint health and reduce pain. Natural remedies for joint pain relief. In addition to dietary adjustments, several home remedies can help alleviate joint discomfort, reduce inflammation, and support cartilage repair. 1. Gelatin for cartilage repair. Gelatin contains amino acids like glycine and proline, which support collagen synthesis and strengthen connective tissues. Recommended method: mix 2 teaspoons of gelatin with 1 cup of cold water before bed. In the morning, add warm water and drink on an empty stomach. Follow this routine daily for 1 month, then take a break for another month before resuming. A study published in the Journal of Orthopedic Research found that gelatin supplementation improved joint function in athletes with knee pain. 2. Turmeric and ginger for inflammation. Both spices have strong anti-inflammatory properties, helping to reduce joint swelling and pain. Recommended method: boil 1 teaspoon of turmeric powder and ½ teaspoon of grated ginger in 2 cups of water. Let it steep for 10 minutes, strain, and drink as tea twice daily. Research from Arthritis and Rheumatology found that curcumin, the active compound in turmeric, was as effective as ibuprofen for reducing pain in patients with knee osteoarthritis. 3. Capsaicin, red pepper extract for pain relief. Capsaicin blocks pain signals by reducing substance P, a neurotransmitter involved in pain perception. Recommended method: mix 1 teaspoon of cayenne pepper with 2 tablespoons of olive oil and apply to the affected joint. Leave for 15 to 20 minutes, then rinse with warm water. Use up to twice daily. Studies in the Journal of Pain Research show that topical capsaicin significantly reduces osteoarthritis-related pain when used consistently. 4. Apple cider vinegar for joint health. Contains acetic acid, which may help reduce inflammation and support mineral absorption. Recommended method: mix 1 tablespoon of apple cider vinegar with a glass of warm water and drink once daily. Alternatively, soak a cloth in diluted apple cider vinegar and apply it as a compress to sore joints. 5. Epsom salt baths for muscle relaxation. Epsom salt is rich in magnesium, which helps relax muscles and reduce joint tension. Recommended method: add 2 cups of Epsom salt to a warm bath. Soak for 15 to 20 minutes up to 3 times a week. A Journal of Integrative Medicine study found that magnesium absorption through the skin can help reduce muscle stiffness and improve joint function. 6. Warm and cold therapy. Heat therapy helps relax muscles, improve blood flow, and relieve stiffness. Cold therapy reduces swelling and numbs sharp pain. Recommended method: apply a warm compress for 15 to 20 minutes in the morning or before activity. Use an ice pack for 10 to 15 minutes after activity or when experiencing acute inflammation. Alternating between heat and cold, contrast therapy is often recommended for chronic joint pain sufferers. Expert insights: the role of muscle health in joint function. An often overlooked factor in joint pain is muscle tightness and imbalances. According to orthopedic specialists, weak or overactive muscles can create unnecessary strain on joints. For example, tight hip flexors can pull on the lower back and knees, leading to pain and misalignment. Similarly, weak quadriceps can cause instability in the knee joint, increasing wear and tear. By incorporating strength training and flexibility exercises, individuals can redistribute pressure away from joints and onto muscles, reducing pain and improving mobility. How to maintain healthy joints for life. By integrating the right diet and natural remedies, individuals can take control of their joint health and significantly reduce pain without relying solely on medication. Key takeaways: incorporate anti-inflammatory foods rich in omega-3s, antioxidants, and collagen. Avoid processed sugars, trans fats, and excessive red meat, which trigger inflammation. Use natural remedies like gelatin, turmeric, ginger, and capsaicin for long-term relief. Apply heat and cold therapy as needed to manage pain and stiffness. Prioritize movement and muscle strengthening to support joint stability. Making these changes can help maintain flexibility, mobility, and pain-free movement well into old age. By taking proactive steps today, individuals can protect their joints and enjoy an active, healthier life. If you like video, share it with others who might benefit, and subscribe to our channel for more health tips and advice. Thank you for watching, and take care of your nerve health.